About 43.8 million people in America have experienced a mental illness. Of those 43.8 million people, 60% did not get help.
Depression is not the emotion sadness. Depression is a state of being below neutrality. Sadness is an emotion that comes and goes just as happiness does. My biggest pet peeve is when someone comes up to you and says something along the lines of, "I'm sorry, I was just depressed earlier. I'm so depressed right now." Depression does not just come and go, it's there. And it is the third largest cause of death among teenagers in this country. 4,400 kids commit suicide a year, and for every one of those, at least 100 attempt.
In an academic journal titled Clinical Depression, it states, "With major depression, it may be difficult to work, study, sleep, eat, and enjoy friends and activities." Anxiety is commonly tied to depression. In an article by the U.S. National Library of Medicine, it explains 73% of persons with major depression have lifetime anxiety disorders, whereas 27 to 72% of those with a diagnosis of an anxiety disorder develop a lifetime diagnosis of depression.
My name is Kenley East. I'm 21 years old and I'm a junior at Weber State, and I'm studying English and I'm in my bachelor's program, and I suffered anxiety and depression since I was 12.
How has anxiety and depression affected you?
It's really affected my social skills and being able to communicate with people in my class and my friends. For me, having anxiety and depression just puts like a big hold on my life. Like, I'm not able to do the things that I want to do, or things that, I don't know, that I've been doing my entire life. It's like a block that I can't ever get past.
How has anxiety affected you in school?
I think the biggest impact it had on me was studying and taking tests. Already having the anxiety in life in general with my own self, and then adding on school and stress and studying and professors and exams, stuff like that, it just makes it super hard to understand the material and to remember the material as well as test taking.
Do you believe that mental illness needs to be treated?
Honestly, yes. I think that a lot of people don't realize how big of an impact it has on everyone. If you ask anyone, at least one person they know has some sort of mental illness, whether it be bipolar disorder, anxiety, depression, stuff like that. The more it goes untreated, the more that people suffer from it. And then the outcome is suicide, attempted suicide, loss of jobs, friends, and just spirals down. Mental illness, I think, is one of the most important things that needs to be treated. It's just like our regular health. You know, if you're sick, you have to go to the doctor. It's just like, if you have anxiety, you need to figure it out. You need to go and get help from someone, a counselor, whether it be medication or some sort of therapy.
What helps you cope with your mental illness?
So I'm on a prescription for anxiety and depression. For me, that helps just keep the edge off a little bit to the point where I can handle it. I know my boundaries and things that I can and can't do. Big groups of people, obviously, staying out super late, not getting enough sleep. So I just know my own personal boundaries and am able to watch and make sure that I can keep myself above water and not sink. So yeah, for me, medication, therapy's also helped, but mainly just knowing myself and what I can handle.
Just as Kenley said, problems with the brain are just as important as any other physical disability. In an article by the European Journal of Public Health, it states, "Mental health and mental disorder, including suicide and suicidal behavior, have been a neglected issue in the public health for many years. Yet, mental disorders rank among the disorders which contribute enormous suffering for affected persons and their families." I have firsthand experienced both severe depression and anxiety. It is so important that mental health is talked about more openly in schools, families, and communities. In an article by Banyan Mental Health, it states, "The topic of mental illness has been difficult to openly discuss over the years, and many people view mental health with a negative stigma. With these issues becoming increasingly prevalent, it is imperative that we move mental health to the forefront of our conversation topics and have transparent discussions about how we are truly feeling.
Just gotta keep going. Hold on to that fundamental quality of faith. Have faith that on the other side of your pain is something good.